Hi, I'm Dr. Jeff Lewis, a physical therapist, athletic trainer, and strength coach. I want to welcome you to our page and just give you a little bit of an overview of what you can expect as you navigate through our page in terms of the type of content we have, the different types of video, and things that kind of go along with that. So, more than anything, again, I'm a physical therapist, an athletic trainer, and strength coach. I currently own Lewis Physical Therapy and Sports Rehab in Point Pleasant. I see a wide range of patients and individuals, predominantly the high school collegiate baseball pitcher dealing with arm pain. And then the other side of my practice is the active adult that is serious and consistent about their training, but has some overuse stuff that has started to get to the point where it's limiting their training, and we kind of find the way to help them navigate that rehab process while allowing them to continue training and stay active in their life. So really from a page overview standpoint, first thing I want to kind of go over is the content that we have on this page specific to adult fitness and training. And I would say that's pretty recently I've started putting out a lot more content on that, whether it is long form content or short form content or both. There is a lot geared towards the adult fitness and training side of things, not only from my personal experience, but just from working with adults in general in terms of the rehab process, certain trends I've seen from an adult fitness standpoint that seem to lead a little bit more towards injury or not. I'm a big believer in identifying those trends to again then just educate patients on how to kind of mitigate certain things. So there's a lot on that in terms of the adult fitness and training side of things. How often should you train? What type of split should you do? What should you do from a recovery standpoint? All the things that go into that. The second part is the exercise demonstration. So if you look under the short section of my page, you're going to find there is a large number of just exercise videos on there. Some of them are annotated, some of them are not. And these are historically videos I've used for patients in terms of developing their rehab plan more than anything. So that's what we use a lot from that standpoint for a specific app that we then use. There's a lot of different demonstrations for certain exercises on there. The third part here is the rehab content, and that goes into this as well, but especially from a long-form content standpoint. So perfect example is there's a couple of videos I have from a long-form content standpoint of how do you navigate a meniscus injury, whether you are a runner, whether you are a lifter. How do you navigate shoulder pain if you are a pitcher? And all of that, and really all of this is just based on the real-life experience I have either dealt with personally myself or from the patients that I see in our clinic. So that is a big piece of this channel as well. And the last part here, it's not as extensive as here, but it's certainly a part of this page, is my own just clips from personal training and just some program insight. So if I run a certain program, it's not uncommon, or what I'll probably start doing is just kind of putting an overview of the program on there, saying, hey, this is what I'm doing, this is why I'm doing it. You can try it, you might not. It's not actually programs that are up for sale or anything. It's just more just people getting insight into the programming I use for my own, because I'm always just learning new ways to go about certain things, and you really have to do stuff first before you can critique it more than anything. So again, welcome to our page. Appreciate you here checking our stuff out. If you have questions on certain videos or whatnot, drop them below in the comment section of that video. I typically get back and respond to it, whether with an answer or, hey, check this clip out versus that.